In a world of information overload, what is remembered? At the International Pemphigus and Pemphigoid Foundation, we offer presentations with strong emotional appeals to increase information retention.
I'm just here to share with you my personal journey, kind of an emotional appeal to help put it on your radar.
To put Pemphigus and Pemphigoid on your radar, we provide special combined presentations with both a patient and a scientific presenter. This unique format gives audience members the chance to learn about the clinical presentation, diagnosis, and management of Pemphigus and Pemphigoid from two unique perspectives. Our speakers have presented at dental and dental hygiene societies, conferences, continuing education courses, and schools across the country. Depending on your audience size and location, the International Pemphigus and Pemphigoid Foundation may be able to send presenters to your group at no cost. Patients share their emotional journey toward receiving a Pemphigus or Pemphigoid diagnosis. They shine a light on the unfortunately common delay in diagnosis and resulting prolonged suffering the average Pemphigus and Pemphigoid patient experiences. Our scientific presenters discuss specific information and tips relevant to the dental practitioner.
Now, Pemphigus vulgaris and mucous membrane pemphigoid are autoimmune disorders that destroy the proteins that variously hold together the epithelium and skin, in mucous membranes and skin.
To complement this scientific overview, patients openly share their fears.
And he told me at that time that he married me for better or worse, and this just happened to be one of the worst. And he stuck by me, and it was within, I don't know, maybe the past couple of years, that he told me the reason why he didn't leave me was because he thought he was watching his new wife die and didn't want me to die alone. Very hard conversation to have, very hard conversation to revisit.
Their pain.
You know, I go back to work right after the appointment, and it's getting so bad that I can't even swallow my own saliva without just tears pouring down my face.
Their laughter.
He asked me a few questions about what was going on and eventually asked to look in my mouth. And when he did, he cringed. And let me tell you, if you can gross out a gastroenterologist, you really are somebody.
Their hope.
And I just thank you guys for listening, because I know in the future you will see someone like me, and hopefully they will be diagnosed much quicker and we'll even have treatment that can cure this disease.
With these emotional testimonials, scientific presenters use their extensive knowledge of Pemphigus and Pemphigoid to cover the following learning objectives. Know key questions to ask when determining whether a patient might have Pemphigus vulgaris or mucous membrane pemphigoid. Understand appropriate biopsy techniques and referral patterns when Pemphigus or Pemphigoid is suspected.
So this is not uncommon at all. Just the irregularity of this erosion here makes us think about the possibility that this is Pemphigus. But the only way to really know is with a biopsy, and that's what we did.
The critical thing is to make sure you have the right sample. So often, patients undergo a biopsy and the clinician collects a sample that's primarily the ulcer bed. And that's going to give us a non-specific result because the pathology is occurring in and at the junction of the epithelium and connective tissue.
Realize the dental professional's unique role in reducing Pemphigus and Pemphigoid diagnostic delays. Understand dental management techniques for Pemphigus and Pemphigoid patients.
And so your considerations in managing the patient with a history of Pemphigus and Pemphigoid is to achieve optimal control of oral health, controlling plaque, and using more frequent maintenance visits as necessary to do that, minimally traumatic mechanical therapies, including routine oral hygiene methods.
Feel more confident and knowledgeable in diagnosing and managing Pemphigus and Pemphigoid.
Here's the basal cells, and this separation is within the epithelium. So these two things together are classically diagnostic for Pemphigus vulgaris.
So the dentist will play a critical role in early detection and timely treatment for these conditions. And there's nobody better qualified than a dental healthcare professional.
Are you interested in learning more about Pemphigus and Pemphigoid? consider inviting a patient, scientific speaker, or both to present at your next dental meeting, conference, lecture, or event.
My prayerful goal is that you guys would take away from this a personal account of something, so that way you can put a face to a disease, basically, and that we're very real people and that there's a lot of rare diseases out there, but this one will affect you.
Will you help us reduce diagnostic delays? Call or email us today to discuss ways to bring this presentation to your group.